My name is Kayla Saylor. This is a presentation for Applied Ethics. The topic I'll be discussing today is free healthcare in the United States. I'll be looking at the pros and cons of this topic. The introduction I'll be looking at for pros is how does free healthcare affect the economy as a whole, and how preventative care goes into that, as well as medical bankruptcy relief. The cons of this topic would be would Americans pay higher taxes, effect on federal deficit, and who will fund this program? The first topic for pro is how does free healthcare affect the economy as a whole? We are looking at billions of Americans who do not receive healthcare annually, with high percentages dying of preventable illnesses if they were to seek the care they needed. Now, 33 million Americans, that's 10.4% of the U.S. population, went without health insurance for the entirety of 2014. And the reason because of this is because Americans fear that they will face substantial debt if they accrue any type of health care to aid in their positive health status. Relating to that, for another pro is preventative care. Free medical care would also encourage patients to ask questions regarding problems that they may have instead of waiting until they can either afford treatment or it gets to the point where they cannot endure it anymore. Uninsured citizens are 3 times less likely to receive medical care as insured persons, so it's no surprise that the uninsured receive less preventative care and have higher mortality rates than those who have coverage. Looking at preventative care, we can see that people are not getting preventative care because they don't have the insurance or any type of health coverage. So they fear that they're going to go into a massive debt or bankruptcy for any type of medical, that includes dental, health checkups, even vaccines, which could be considered a preventative care as well. And because of this, there's results in either the issue getting worse or mortality. Another pro of free healthcare is there would be medical bankruptcy relief. Medical expenses account for 62% of bankruptcies in the United States. 62% is due to medical expenses, and a large number of it shows that a significant amount of Americans are affected by medical expenses that they cannot afford. If healthcare were to be provided for free, the medical debt would reduce significantly or no longer exist because the government, not private citizens, would pay all of the medical bills. Now, looking at this topic, you would assume that this would help in preventative care, and I agree. If a person was not afraid to get their preventative care, they would probably have less medical bankruptcy. And this is because they wouldn't wait until the issue got worse, which requires more effectiveness and more medical attention than if it was to be addressed right away. Now, what we're going to look at is the cons of free healthcare in the United States. The first topic is would Americans pay higher taxes? So in European countries with a universal right to healthcare, the cost of coverage is paid through higher taxes. Sounds super great, right? Well, in the United Kingdom and other European countries, payroll taxes average about 37%, which is much, much higher than the 15.3% payroll taxes paid by the average U.S. worker. Now, Americans would say, okay, great, free health care, but I would assume that when they were to look at their bank stub from their payroll from their employer and look at the massive increase of tax deductions because of free healthcare implementation, they would probably have a different mood on the subject. Cons, another topic would be the effect on the federal deficit. Now, studies have shown that the expansion of insurance coverage under Obamacare will increase the federal deficit by $340 to $700 billion in the first 10 years. Now, this can increase the deficit to 1.5 trillion in the second 10 years. If free healthcare were implemented, there would have to be other resolutions on how to pay for such a benefit for Americans. If every person were covered under universal right to healthcare, there would be an increase in the federal deficit that would be exponentially larger than under Obamacare. Now, when we looked at raising taxes, we would see that probably not a lot of people would be open to the idea of using, tax deductions to pay for free healthcare. So we're looking at how are we going to find funding for this healthcare? Is it going to be all on the federal citizens or the federal bureaucracy to pay? And I feel like that would create a huger deficit in our federal finance. Another con is who will fund the free healthcare. So if the tax deductions, like I discussed a few minutes ago, were not a successful payment source for healthcare, the U.S. Budget Committee would have to look at other options to fund. Now, if they were unsuccessful to pay, America will see a drastic deficit due to healthcare. Now, in conclusion, the lack of properly funded healthcare affects not only the American people, but our nation as a whole. And will our nation see an even bigger financial impact if it were responsible to fund an incredibly expensive program? And generally, nothing is free, and somehow, in some way, things must be paid for to be created and to keep alive. And so if we want to, and I think that that's really important, in my personal opinion on this matter, I feel like free healthcare is probably, I'm more on the con side, because I agree. I feel like there are, things that we'd have to look at, and I feel like it would make a bigger negative impact than a positive one. And also, I feel like there's going to be strings attached. So if our taxes aren't working, if the tax deduction is not working, what other kind of things in our daily lives is going to be affected just to pay for this free healthcare in the United States? Now, that is all that I have on my presentation on free healthcare in the United States. I hope that I have given you enough information to come to your own general conclusion on this topic. I thank you for listening, and you have a great day.